Hi, Dr. Ahaddian. Continuing the discussion of grief and loss and how we deal with losses. As I discussed in the previous program, the stages that we go through normally after a death of a loved one and significant other happens are certain processes and certain levels of first denial, then anger, then negotiation, then acceptance and depression. The denial phase, by the way, in any of these phases, if there are any kind of regression and fixation that a person would be stuck, would cause problems that needs psychotherapy and treatment. And this regressions and inability to move from one phase to another are related to what happens to us in our childhood and where we are standing and where we are when we lose something very important to us in our childhood. For example, if a 3-year-old or 2-year-old or that age group loses a very important support system or any kind of like perceived interested object in their lives, they might go through a phase of anger first, and the anger related to the temper tantrums that we would see at that age group, if it's not dealt with appropriately, and if the parents, the support group, the environment is not stable enough to be able to let that anger to be expressed, to be dealt with, the anger would stay there and then continue its course throughout one's life. Now, any one of these stages, if it's not being dealt with and let that to be expressed appropriately and normally, there would be a problem later in life. Some in denial phase. Denial phase usually causes a lot of problems with regard to drug addiction, dealing with problems in life that continues to show itself as denial, and denying oneself of happiness, denying oneself of food, denying oneself of love. And then all these phases are going to continue. The anger phases, anger towards self, anger towards others, anger towards life, which continues again in different kind of perspectives, which, by the way, is not our fault. And what happens is that where we are standing in our lives would be the important fact that causes us to be who we are in our lives throughout life, actually, with experiencing the loss. Basically, life is a loss altogether, in a sense that when we are born, we step towards loss and losing one's life, which is at the end. And the way we go through the process of these losses are very important to have in mind where we are, what kind of life we have, what kind of support system we have, in what kind of situation we are being grown up, and what kind of genetic background we have. All of these are extremely important in one's dealings with losses.